Nigeria Center for Disease Control confirms 132 new COVID-19 cases. Nigeria Hydrological Services Agency confirms no explosion at Kanji Dam, says dam is safe. In international news, wildfires still raging across western United States with deadly consequences. And in sport, African Women's Tournament holds July 2022.
This is ANN News.
I am Olajumoke Olatunji. Nigeria's coronavirus cases have now reached 56,388 after the Nigeria Center for Disease Control announced 132 new infections on Monday night. Lagos recorded 52 of the new cases, while Gombe confirmed 27. Plateau and Kwara posted 17 and 10 respectively. Enugu and Ogun billed 10 cases each. Katsina, Ekiti, Bauchi, Osun and River State also recorded new infections. NCDC also reports more than 44,000 patients have been discharged from various isolation centers across the country. Nigeria Hydrological Services Agency has denied rumors of an explosion at Kanji Dam in Niger State. NIHSA Director General Clemens Inze has described the report as fake. He says the agency has investigated the report and found nothing there. So he has asked Nigerians to disregard the information. Inze says Kanji Dam is safe and that the agency was working in synergy with operators of major dams across the country. The federal government is working a meeting with leaders of the Nigerian Labour Congress, Academic Staff Union of Universities, NECA, and the Trade Union Congress over the recent increases in electricity and fuel prices. The Academic Staff Union of Universities had earlier accused the federal government of surrendering the growth and development of the country to the International Monetary Fund and the World Bank. Also says the federal government should be ready for more crises. Also on Monday, the Trade Union Congress of Nigeria gave the government a 7-day ultimatum to reverse the recent increases in electricity and petrol prices. TUC wants the government to explain the condition of the country and the reasons for the price hikes. The federal government had said earlier the reason for the hikes was the sharp drop in its revenues, which has made it impossible to maintain the subsidy regime. Labor and civil rights groups reacted by saying the government is insensitive. Meanwhile, the federal government is appealing to the joint health sector unions to suspend its 1-week nationwide warning strike. Health Minister Dr. Osage Ihanere says it is important for JHESU to negotiate with the federal government, especially at this time of global health emergencies when its services are urgently needed by citizens. COVID-19 is causing significant people, social and economic dislocations for organizations as it continues to decimate several sectors. Respondent Kelechi Mekalam reports on how business owners are adapting to the new realities.
Another client's order heading out for delivery. It's a new strategy embraced by Woks & Koi, a Chinese restaurant in Nigeria's capital, Abuja. Before the coronavirus pandemic, it operated majorly as a dine-in, where clients love to relax and treat themselves to some Chinese cuisine. But with the COVID-19 lockdown and restrictions, the dine-in was no longer an option, and several restaurants and diners like this one were forced to close shop. But for the management of Woks & Koi, shutting down wasn't an option. They turned to digital marketing to keep the business going.
For me, I would say COVID-19 has made us to have more customer, more client by ordering online or sometimes by giving us a call on our contact number. We have our Instagram page whereby we showcase our meal our food, and we have calls from there. And like I would say, like 60% of most customers we have now with this COVID-19 pandemic are customers that we don't know and new clients, because they made use of the social media service to make an order.
But transitioning hasn't been a walk in the park. Management and staff are still struggling to deal with the challenges that come with the new system, especially as their customer base expands.
We have 2 bikes that do our deliveries, and that is not enough because of the turnover of customers.
Delay because of the major securities stopping you on the road, doing all these checkpoints. Sometimes our customers do complain of the order getting to them late.
Nigeria has been reopening various sectors of its economy. For instance, just recently the country's international airspace reopened. And although the impact of the months of lockdown has been hard on businesses here, like Wax and Koi, several businesses are seeking innovative ways of turning the adversity into opportunities as they explore new ways of keeping their businesses afloat.
Coming up, African stories. Rising dam levels provide drought-hit Cape Town with much-needed relief. And later, international news. U.S. wildfires still raging, consuming whole towns, killing residents.
You are watching ANN.
Somewhere in the world, every second of the day, news is happening. And of course, Nigeria is bustling with news day and night. That is why ANN doesn't sleep. Our eyes are peeled, wide open, so no story escapes our radar. We stay abreast of world events and happenings at home. We keep you up to the minute in the world of sports. We give you information to stay on top of your investments and all the hard facts you'll need to navigate your day. If you miss us on air, you can keep up to date on our website and on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. We are ANN, Africa News Network. We do news right in a truly African spirit.
Welcome back. This is ANN News. Continued good rainfall in South Africa's Western Cape has seen dam levels across the province reach their highest levels in 4 years. This has brought some relief to the city that has had to ration water because of the biting droughts that has hit the region. Correspondent Travis Andrews sheds more light on the turnaround.
It's a sight that has brought a huge sense of relief for many in Cape Town. The Berg River Dam, which is one of the city's main water sources, is now filled up above capacity. In fact, all the dams supplying the Cape Town metropolis are now holding water at well over 95% of their capacity. That's a significant improvement in water levels since the drought began.
The dams are full, and it is a sight that we're all ecstatic about because we haven't seen this since about 2014, when we had all of those dams almost full. They're about 95%. Some of them are full, and they obviously all vary. But it is very amazing change, given the fact that we were right at this day zero and we're concerned in 2018, round about January, whether we'd even make it through till the next winter rains. So it's an amazing turnaround.
A succession of storm systems have brought torrential rains and flooding help fill up the dams to near capacity. Snow mounting from the surrounding mountain peaks also assisted as runoff flowed into the catchment areas. With level 1 water restrictions still in place, an average of 633 million litres of water is being consumed every day. That's just half of the pre-drought volumes.
And it's not necessarily because we've had more rainfall, because our average rainfall right now is slightly above average. What we really have done better at is to manage the water, and that's why those dams are so full right now. A combination of the average rainfall being where it is, but also mostly we've reduced our demand for water by over 50%.
Cape Town residents, though, are not likely to receive any financial benefits for being water-wise. That's because the city won't be dropping water tariffs yet, as consumption may have dropped, but supply costs still remain the same. Reducing water rationing is, however, being considered.
Currently on level 1 water restriction, so a level down from that essentially would be no restriction, or what we would term being water-wise. We will make an assessment at the end of the official rainy season or the hydrological year, which is at the end of October, and we will look at a range of factors to determine what the suitable restrictions are for the new hydrological period.
The dams may be healthy, but that might not be for much longer, because seasonal changes will bring warmer weather and less rainfall. City officials here are also urging all residents to maintain their water-wise approach that helped avoid day zero from becoming a reality.
Kenya says its health workers would be among the first participants in the COVID-19 vaccine trials. Kenya joins South Africa, which is among 8 other testing grounds on the continent. The African Academy of Sciences says only 2% of clinical trials globally for all types of vaccines take place in African nations. Respondent Robert Magila has the story.
These are the people that will be among the first participants in Kenya to take part in clinical trials for a COVID-19 vaccine being developed by AstraZeneca in partnership with Oxford University. The trials, to be conducted by the Kenya Medical Research Institute and partners, will recruit close to 400 health workers along Kenya's coast and are scheduled to begin later this month, making Kenya only the second country on the continent after South Africa to take part in vaccine trials.
Having a local group participate in these studies will help inform whether this vaccine is for us. Does it require any modification? Is it going to do harm?
Health workers are being prioritized due to their high risk of exposure to COVID-19. In June this year, the government announced over 450 health workers had tested positive for the virus. Dr. Peter Munyu says the success of the trials will depend on a number of factors.
In step 1 and step 2, they are looking to see whether it is safe, and secondly, whether it is going to create the resistance that we are looking for, or what we call immunogenicity.
Those we spoke to on Nairobi streets backed the trials in the country.
We are contributing in our own little way, and we shouldn't be complaining so much about that thing.
The way things are here, we should try anything that helps us. I don't think it's a bad thing.
I will not refuse. If it's successful, we will be among the first to get the vaccine.
With more than 1.3 million COVID-19 cases and over 32,000 dead, there's been a concerted effort by African countries for access to a vaccine once it's available. The World Health Organization says international donors have so far raised $700 million to purchase vaccines for poor countries. 8 African countries, among them South Africa, Gabon and Namibia, agreed to self-finance access to the vaccine.
Chinese peacekeepers serving with the United Nations in Juba have recently successfully completed the UN Armed Escorts mission from Juba to Mongala. The Juba-Mongala route is one of the most important material supply lines in South Sudan. The number 3 Chinese peacekeeping infantry company dispatched 20 soldiers and more than 10 vehicles for the mission. South Sudan's severe COVID-19 epidemic situation has meant the medical personnel from the force had to thoroughly disinfect escort vehicles and equipment after completing the mission. Every soldier involved with the mission was quarantined after the mission ended. So far, the Chinese No. 3 Infantry Company has completed 10 UN armed escort missions.
When we return, international news. U.S. wildfires still raging, consuming hotels, killing residents. And later, sports. African Women's Tournament hosts July 2022.
You are watching ANN.
Whether in your house, at your office, on your phone or online, we are there. We have the facts behind the headlines. We cut to the chase with the news you really need. We cover every angle. We are the bigger, better news network. We are African News Network. ANN. Watch ANN News on MITV from a truly African spirit.
Welcome back. This is ANN News. Death toll has increased in the wildfires raging across America's west coast. Warnings of strong winds that could fan the wildfires even further have added urgency to firefighters' efforts. Authorities in Oregon say they can now account for nearly all the dozens of persons reported missing, but yet the fires have killed 35 persons from California to Washington state. Respondent Mark New has the story.
The smoke in the state of Oregon is so bad that it can be seen clearly from space. Despite the dangerous conditions and evacuation orders for an estimated 500,000 people, Dale Carlson has chosen to stay behind, helping residents get fuel and firefighters with supplies.
Well, as long as the roads are open, you can drive right through. You just can't be afraid of the fire on either side of you.
But tens of thousands of people have decided to flee their homes. They're coming to places like this, the Oregon State Fairgrounds, to seek food and shelter.
Check in with folks about how they're doing.
Representatives from nearly 30 organizations like the Red Cross and the United Way are joining forces to provide both physical and emotional support.
You can see it on their faces. This kind of impact and trauma, it has like a PTSD factor to it, where they really are those cognitive abilities of what to do next, where do I turn?
We had a gun up there and we were all preparing to start figuring out who was going to be the one to take care of everybody so that they didn't burn.
Lindsay Dry is from another state. She said she was escaping domestic violence with her children, camping out with them in a nearby mountain. When the fire came, they had to leave all their belongings behind and survive a harrowing drive down the mountain.
It was kind of eerie because with the winds and everything, also there was also trees that were knocked over in the roads that we were having to stop and get out and remove from the road so that we could get through. It was the road and the whole mountainside through the canyon, like all you could see is just flames, and then it went black, gray, and then white, and it just covered the whole sky.
She says they were able to follow other drivers who had keys that opened up gates that would otherwise have been locked. She's just coming to grips with her family's narrow escape.
It took me about a day and a half before it actually really hit me what actually had happened, and that's when I started actually crying, and then it's gotten better. I mean, I'm just trying to look forward and not really look behind it, because that's behind us now. We have our lives, and that's what matters. So
Lindsay's family is just one of the thousands who believe they are so fortunate to have made it, but also now wondering, where do they go next?
Critical blood supplies are way down in Mexico. The decline is driven by fears over donating during these pandemic times. The health officials have created a new strategy to encourage donors to come forward. Correspondent Frank Contreras tells us how that works.
Historically, Mexico has had one of the lowest rates of blood donation in all of Latin America. The coronavirus pandemic only made matters worse. With COVID-19 spreading, many Mexicans are staying away from hospitals and clinics, fearful of catching the virus. As a result, blood donations are down more than 75%. So Mexico's Secretary of Health came up with a plan: send mobile blood donation vehicles directly to donors' homes. They only need to make an appointment.
I tried to donate every 2 months regardless of that, and I would do that even if there was no pandemic. But with this situation, I feel even more obligation to do it and to invite my friends and neighbors so they too can contribute.
Medical doctors and nurses check all the vital signs of potential donors and guard themselves against contracting the coronavirus. This doctor says most of the donors have been young people.
We have to address our youth and invite them to believe that their donations help us very much, because blood cannot be replaced with anything. Blood is replaced only with blood.
The National Director for Blood Donations in times of the pandemic is Dr. Jose Luis Salazar.
Young people, the most vilified millennials, are the ones who are adapting most quickly and helping bring well-being to our communities. They are the ones who most visit our mobile units.
The blood is packed away safely in coolers. Within a few hours, it is taken directly to hospitals and clinics. The Mexican capital has one of the mobile units. 11 others are spread out in cities across the country.
This ice chest contains the donations of 3 different people, a total of 1.5 liters of blood that will be donated to this local hospital here in Mexico City.
Now, patients awaiting surgery or those fighting cancer can rest assured that there will be enough blood available to help keep them alive.
A combination of financial incentives, health issues, and the potential to develop a more severe case of COVID-19 if infected have given Australian smokers more reason to give up the habit. Studies show about 12% of Australian population lights up. That is one of the lowest smoking prevalence rates in the world.
We know that it's been going down almost continuously since government started taking it seriously, running big mass reach campaigns, banning smoking in indoor areas.
Smoking will kill 2/3 of its long-term users, so it's seen as quite a proper subject for taxation.
A lot of careful research went into the way in which packets were designed to make them maximally appealing to different demographic groups. And so we put that argument to government that they banned tobacco advertising in every other medium except the pack. And that was the most important argument in doing it. They wanted to finish the job.
The daily smoking habit in Australia is also becoming increasingly expensive for some people. Australia's government has approved 2 tax hikes on tobacco products this year alone, making the country home to some of the most expensive cigarettes in the world.
If you quit smoking, what we're really showing is that at least, so these genes that help the COVID replicate or enter into our cells go down quite rapidly. In our study, we showed up to, if you quit, a month later, it is already down. And then by 1 year, you completely lost the effects of smoking in relation to the expression of these genes.
World leader in trying to curb smoking rates. In 2012, it became the first country to require cigarettes to be sold in plain packaging with health warnings and stock images.
A lot of careful research went into the way in which packets were designed to make them maximally appealing to different demographic groups. And so we put that argument to government that they banned tobacco advertising in every other medium except the pack. And that was the most important argument in doing it. They wanted to finish the job.
Up next, sports. African Women's Tournament hosts July 2022. Please stay with us.
You are watching ANN.
We are on the road every day, canvassing throughout Africa for news you really need. We follow the story everywhere, from every corner of Nigeria to the wide African expanse. We bring you what's making headlines. We connect you with news you can use. ANN, African News Network, in a truly African spirit.
Welcome back. This is ANN News in Sport. Confederation of African Football has confirmed that the postponed 2020 African Women's Cup of Nations will now hold in July 2022. No host nation has yet been announced. The Women's Continental Football Championship was postponed because of the COVID-19 pandemic. The CAF Executive Committee also ratified the commencement of the Women's Champions League to be held yearly on an 8-team format. Belgian football fans are set to return to stadiums for top league matches. Real numbers will be strictly limited by social distancing. This will be the 5th game of the new season for these clubs. Matches have been played behind closed stadiums since the March lockdown, and more than 6,000 fans were allowed into the stadium on Sunday, way below its maximum capacity of 22,000. Fans kept 1 meter apart, separated by empty seats. They also wore masks throughout the match. And that is ANN News this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatuji. Have a pleasant evening.